Good to go? Great. Thank you, everyone. It's good to be here today on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. And it's also good to be here with Minister Dix and Dr. Bonnie Henry to talk about the next steps our province is taking as we prepare for the fall and winter pandemic preparedness plan. Healthcare, of course, and a strong public health response to COVID-19 has been foundational in our province's recovery. And we're preparing for the challenges that the influenza season will bring to an already challenging pandemic situation. Obviously, COVID-19 is still with us. Our plan has been working, but we need to intensify our activities as we come into the cold and flu season. We still have to keep washing our hands. We still have to focus on physical distancing. If you can't physical distance, please wear a mask. And of course, if you're sick, stay home. Our government has been fighting COVID-19 with a variety of mechanisms. Testing has been increasing up to 6,000 tests a day. Contact tracers have been hired. More contact tracers are coming. And of course, we're making sure that those who need care get it. Today's announcement focuses on that very issue. To prepare for the fall and winter, we are investing $1.6 billion into our healthcare system. This will mean 7,000 jobs for healthcare support workers in long-term care and assisted living facilities, a significant expansion of the province's flu immunization plan, as well as the launch of a new program, which is particularly exciting, the Hospital at Home program, to reduce the chance of transmission in our acute care facilities. Of course, a key element of this plan is the Health Care Access Program, which provides a path for people without health care experience to get on-the-job training. And that means, of course, good news for those in the hospitality sector and other parts of British Columbia's economy that have been affected by COVID-19. These are opportunities for 7,000 good-paying jobs that focus on our common goal to keep people healthy, to keep them well through the pandemic. We also, of course, will be focusing on the influenza season. 450,000 additional doses of flu vaccine have been procured by the province to bring the total available to 2 million, and 45,000 high-dose flu vaccines available for those vulnerable populations in assisted living and long-term care facilities. All of these measures are important to protect our seniors, the most vulnerable people in our populations. I want to talk a little bit about, before I pass the microphone on to Dr. Henry and Minister Dix, about the Hospital at Home program, because this is particularly exciting and new to British Columbia. And the approach, of course, is to make sure that eligible patients can get the care they need outside of an acute care facility and ensuring that, of course, they can get that care in their own home. For many patients, especially elderly, this means that they will be able to avoid complications that oftentimes emerge in our acute care facilities. Hospitals at home reduce pressure on hospitals, and of course it's critically important as we go into the flu season that we make sure that our hospitals are not congested when they don't have to be. Hospital at Home will start here in Victoria at the Victoria General Hospital, and then over the coming months roll out to other acute care facilities and communities across British Columbia. This, of course, is a major step forward as we come into the fall. Our pandemic plan has been working. We need to accelerate and we need to up our game, not just in the delivery of services, but citizens across British Columbia. Dr. Henry and Minister Dix yesterday spoke about new health orders to get that caseload down to manageable numbers. And I again appeal to all British Columbians to follow the directives that have been put in place. It's in the best interest of our people. It's in the best interest of our economy. And if we are going to continue to lead the country in fighting COVID-19, we have to get back to that ethic that got us to that enviable position by working together, by focusing on the directives that will make sure that all British Columbians are safe during this most challenging of times. Of course, we're going to be seeing kids returning to classrooms tomorrow. I'm particularly excited about that, but I do know that there are parents and others in the system that are particularly anxious I want everyone to know in British Columbia that we will do everything we can to keep people safe, not just in our schools, but in every facet of our endeavors, whether it's in the economy, whether it's in social gatherings, whether it's in critical institutions like our hospitals, our long-term care facilities, and our schools. And with that, I'll invite Dr. Henry and Minister Dix to go into the details of our pandemic preparedness plan for the fall. And I think I'll start with Minister Dix or Dr. Henry? Dr. Henry.
Thank you very much, and good afternoon. So, as you know, as we managed to move into our restart plan over the summer, we have had increased numbers of cases of COVID-19. This is something that we have expected. We knew that as we took those all-important steps of restarting our social connections, our economy, that we were going to see more cases, and we have focused on making sure that we could manage and that we could do the contact tracing we needed to keep the transmission chains low. But as we move into this next phase of our pandemic in the fall, where we know to have respiratory infections. We know the impact that has had historically on our healthcare system, in particular, on long-term care homes and on our hospitals. So we need to increase the work that we're doing, and we need to be prepared for what might come next in this next phase. The foundation of the plan is the need for a strong and ongoing focus on sustaining the infection prevention and control measures that we have in place across our system, whether it's in the community, the work that we're doing with public health, in long-term care, in hospitals. And we also have a focus on a number of other key areas that we've heard the Premier mention. So strengthening public health, strengthening our protection of vulnerable seniors and elders in our communities, and people at risk, and ensuring that our health care system is ready to respond as we need. To start off with, I'm going to talk a little bit about what this means for our public health capacity. We will be increasing our testing capacity to be able to manage both testing for influenza as well as COVID as we move into the respiratory virus season. And that means our capacity of about 20,000 tests per day. This is a challenge. It's a challenge in a whole variety of ways, not the least of which there's a global shortage on some of the reagents that we need for the equipment that we have here. But we have started on these plans when this first all arose in March, and we have systems in place. We're working with our colleagues across the country to make sure that we have in Canada what we need to do this, and we're well on our way to get there. We also are looking at increasing the resources that we have with our public health teams across the province for the important measures of contact tracing. As you know, every single case of COVID-19 is followed up by public health in this province, and part of our role is making sure we can identify those people who have been exposed and are at risk of developing symptoms, so we can support them to isolate, to stay away from others, so if and when they do develop symptoms, one, they can get the support they need, but also they're not passing it on to others. That is very labor intensive, and for the 3,000 and some people right now who are in isolation and being monitored by public health, you know what I'm talking about. But it also is really important that we have that human connection to be able to do that, to answer your specific questions about what it means for you in your situation. We'll also, of course, be looking at whether we can have things like the CAN app help us with that. But right now, the important functions are being done by real people who understand the issues. And we've announced already that we'll be hiring 500 new contact tracers, but we have had an overwhelmingly positive response to that. And we've now increased that number to 600 people, some of whom have been hired already and will be working around the province to support this incredibly important function. As well, one of the important things that we need to do is everything we can to protect ourselves and those at risk from influenza this season. So our fall influenza campaign is going to be on a scale that we have not yet seen to further protect people who are vulnerable in this province. And we encourage everybody who's over the age of 6 months to be immunized for influenza. And we'll be looking at how we can provide influenza immunization in settings in communities, in physicians' offices, through pharmacists, in our healthcare sector, and through public health clinics around the province. And we've been working on those plans. We've increased the number of vaccines that we have available, including some of the vaccines that work specifically in our elders and seniors. That's the high-dose flu zone vaccine. So these are going to be made available. And in addition, we've bought the amount of vaccine, an increased amount of vaccine that we've ever had in the province. We have been looking at what has happened with influenza in the southern hemisphere. As we know, influenza circulates in the northern hemisphere, generally starts in October, November, and peaks around in December and January. And in the southern hemisphere, they have just seen the peak of their influenza season. So the good news that we've seen out of the southern hemisphere is that their immunization rates were very high. And this is one of the things that we recognized early and have triggered us to purchase more vaccine here, because we know how important it is to protect us all from influenza. The other things that we've seen in the southern hemisphere are that the measures we've put in place to deal with COVID also help protect us from those other respiratory infections. So we need to continue doing the things that we're doing, like washing our hands regularly, covering our mouths when we cough, staying home when we're sick. And right now, it's going to be incredibly important for all of us to protect ourselves, our families, and our communities by getting immunized for influenza as well. The other thing that does is help reduce the impact on our healthcare system, because we know that when people are infected by influenza, particularly we know influenza makes younger people and older people more severely ill and can lead to hospitalization, both from the infection, but also because influenza can exacerbate some of those other conditions we have. So that is going to be incredibly important for us in the coming weeks and months. And I will turn it over to Minister Dix to talk to you about some of the other issues.
Thank you very much, Dr. Henry. And I'm just going to move the slide around. Let's see if I'm going to do this right. There we go. As part of our plan that we've prepared for the fall and into the spring, obviously, a key aspect of that we've seen from the beginning of the COVID-19 pandemic is the need to protect vulnerable seniors. So as the Premier has announced, we're ensuring robust infection prevention and control practices across all assisted living and long-term care facilities, with funding to hire up to additional 2,000 staff for that purpose. Major recruitment and training strategy as well. There will be put in place for the additional healthcare aides, cleaning and food services staff across long-term care sector, up to 5,000 new staff to add additional capacity. This brings us up to a total of 7,000 additional staff in assisted living and long-term care homes. This is, of course, to address the needs of the COVID-19 pandemic, but also as we continue to aspire to raise care standards, which is the plan that has been in place since 2017. In addition to that, as part of the immunization plan presented by Dr. Henry, flu zone high-dose immunizations will be available to all residents of long-term care and assisted living facilities as part of that plan. This is support provided by the federal government. It's about 47,000 doses of the 1.965 million doses that we're presenting across BC, and we're very appreciative for their support. An example of our protecting vulnerable seniors, of course, is the $44.1 million that we're putting in place to recruit the estimated 7,000 healthcare worker positions. The program that we're putting in place will provide a path for interested applicants to receive formal, on-the-job, modular training. New hires in the program start in a healthcare support worker position and receive paid training that leads to full qualifications as a healthcare assistant. Oops, we'll move this along. You see, I got to get better at this clearly.
Run the machine.
You want to run the machine? Can you run the machine?
There is a little delay.
When I was in high school, I don't know if I can.
Yeah, see, we're having. We're going backwards. Okay, we're going to see where we are here. I'm looking at the wrong thing clearly. And so this campaign is open to all interested individuals, but it will also specifically target people who have lost their jobs due to the COVID-19 pandemic, in particular people previously employed in the hospitality and service industry. The starting salary for healthcare support workers is approximately $20 an hour, with fully qualified healthcare assistants earning approximately $23 an hour. For more information on the Health Career Access Program, you can visit the Government of British Columbia website, that's gov.bc.ca, and search Health Career Access Program. We're also, in addition to those efforts in terms of seniors care, in terms of long-term care, in terms of assisted living, we're also strengthening primary and medical specialist care for at-risk patients. We're developing patient care guidelines and best practices for COVID-19 patients, including rapid referral pathways to a higher level of care as required. And you've seen these in action, and in particular in the outstanding results we've had in British Columbia for those who have been hospitalized and those who have been in critical care. We're also developing patient care clinical guidelines and increase access to virtual care for older patients and or individuals more likely to experience a serious form of the illness due to an underlying chronic medical condition: cardiac, diabetes, renal, respiratory cancer, a compromised immune system. We're planning, of course, to position and to continue to position urgent and primary care centers. We announced our 19th in West Kelowna yesterday, and other designated primary care clinics as acute respiratory illness centers for the coming fall, winter flu and COVID-19 season as required. And I want to say to all those who've worked in the urgent and primary care centers what a central role they played in March and April and in May. They have provided outstanding service up to now. It's been, I think, an excellent initiative up to now, but they have absolutely proven their weight in gold during the COVID-19 pandemic. I want to go on to the next. See, I got to keep going on to the next page. We got to implement, we're continuing to implement the patient transport and access to care in rural remote areas, the plan that was announced by the Premier on April the 20th, and it continues to be put in place across communities. The important fact to deal with transmission if it occurs in rural and remote areas, to be able to bring people to acute care as required and provide supports in those communities is a crucial aspect of our plan and central to building confidence throughout British Columbia, not just in urban areas. We're also preparing for increased inpatient hospital demand. You saw in March, at the end of March, when we presented our plan for hospitals based on modeling at that time, that we were presenting and developing this plan against what had happened in Hubei province in China, what had happened in Italy at that time. That's how we presented our plan and some of the dramatic measures we put in place. And as we've done in that, we've mapped out inpatient hospital bed supply against likely demand. But this time, of course, is based on our own experience. Hospital occupancy from 2019, based on fall-winter months, including the effect of a typical influenza season, where there are more respiratory admissions. And addressing, of course, the continued increase in surgical demand based on our surgical program that has been put in place is obviously part of this plan. And you can see that in detail. Members of the public and members of the media can see the 50-page PowerPoint presentation where we lay these scenarios out in detail, and the 60-page plan that presents our plan in detail that will be available on the Government of British Columbia website for everyone to see. We're preparing for 4 potential scenarios. A low COVID-19 case scenario. This measures the situation in June with low numbers of daily new cases and admissions, representing a minimal number of COVID-19 beds required among a limited set number of sites. So this would be ICU 25, acute care 57. That's the low scenario. Just to put this in context, our current situation is 12 people in ICU and 32 in acute care hospitals as a whole. The second scenario is a moderate one, increasing transmission resulting in a moderate number of COVID-19 cases and admissions. This would be ICU 55 and acute care 98. We have a scenario to deal with high COVID-19 cases, ICU 108 and acute care 201 occupancy. Just to put that in context, we are planning for above what we saw in the spring under that scenario to ensure that we're ready should that happen. In the spring, those numbers were 72 at the height in critical care on April 5th, and 149 in hospital. And we are preparing for planning purposes. We don't see this happening, but for planning purposes, a very high COVID-19 case scenario that would include 214 in ICU and 400 in acute care capacity. And so what are we doing? What are we putting in place for that? You see that in the following page. It's obviously robust infection prevention and control practices across hospital site, including for individuals. We're implementing a number of management strategies, from operationalizing surge bed capacities for early fall to meet routine increased surgical bed and COVID-19 demand for scenarios 1 to 3, and develop a contingency plan for scenario 4. We're establishing emergency department COVID-19 and routine pathways, both respiratory and non-respiratory. We're maintaining restricted visitor policies, implementing COVID-19 cohorted wards and ensuring isolation capacity, and continuing critical care and ventilator management strategies for ICU and acuity units. And we're prototyping, as the Premier has mentioned, a hospital-at-home model and other acute care management strategies to reduce inpatient medical bed demand. Our ongoing focus is on building, strengthening, and planning health human resource capacity across our hospitals. And just to speak more specifically to the hospital-at-home model, this is to reduce the chance of patients being exposed to COVID-19 in BC's hospitals. We're dedicating $42.32 million to the launch of Hospital at Home, an innovative program which has seen success in other jurisdictions around the world. Through Hospital at Home, admitted patients who meet the criteria will be offered 24/7 care at home rather than staying in a hospital, but remain under the direct care of the hospital. Hospital at Home will first launch through the Victoria General Hospital and then through other additional health authorities, including in the north, and hospitals over the coming months. I want to just move on to say that obviously I report weekly on access to personal protective equipment, and yesterday, and you see some of the numbers of what we have brought to British Columbia since March: over 6,300,000 N95 or equivalent respirators, almost 50 million surgical or procedure masks, over 2.6 million pieces of eye protection, over 90 million pairs of gloves. This was as of August 31st. Last week, as you know, 25 million pairs of gloves came into British Columbia, and almost 8 million gowns. We presented information, just so you know, on July 27th, and I refer you back to that, about what our volume targets are for the next 6 to 9 months. At that time, they were 58.1 procedure and surgical masks, 6 million additional N95 or equivalent respirators, 349.71 million gloves, and 2.4 million gowns. And just to bring you up to date on the costs, in July I reported that over $114 million had been spent on PPE from January to the end of June. Today I can tell you that through August that number is $136 million. So just to speak briefly to the budget impact of all of this, the Ministry of Health has received an operating budget increase of $1.6 billion and a capital budget increase of $150 million for 2020-2021 to respond to the healthcare requirements of COVID-19. This includes $374 million for public health measures, $416.6 million for community and long-term care measures, $783.9 million for recovery and increased health capacity, $150 million for renovations and equipment to support the healthcare system to respond to COVID-19. This includes approximately $850 million for a number of initiatives already announced. Those include increased contact tracing staff announced by the Premier a couple of weeks ago, the enhanced rural remote transportation framework, the single site staffing initiative, which is $165.4 million, the surgical renewal plan, and increased spending for personal protective equipment. So to summarize, with nearly $1.6 billion in additional funding and a comprehensive set of actions now underway, the BC health system is well placed to meet the demand, with the backstop of knowing that we can successfully implement more extreme hospital access control measures if they are required. With a planned surge capacity in place, it will be less likely that we will need to reduce access to services. And this is the plan: to learn and to learn again from what we did in March, and to only use the measures we need to use to ensure that we can deal with COVID-19 and continue to allow the healthcare system to operate through all the other things that it has to address in a given day, week, month, or year. Focus on continuing to build out needed health human resources, and you see that the hiring, training, and effective deployment of staff remains a priority. Hospital planning is focused on 19 COVID-19 sites, with remaining hospital sites dealing with a small number of local cases. This approach is supported by work underway to ensure responsive patient transportation and support service in rural areas of the province. We're taking a range of additional measures to strengthen our capacity to manage COVID-19 and reduce normal historical demand on inpatient medical beds through the fall-winter of 2020-21. Notwithstanding these actions, there's an ongoing need for all of us to sustain the infection prevention and control measures across commercial, work, and social settings. It's up to all of us. This is a response, a comprehensive response for the healthcare system. Our healthcare workers, our healthcare professionals have done extraordinary things in the past months, but so have the people of BC. And for us to succeed in delivering not just the surgeries we do in a normal year, but more, to succeed in delivering better primary care, and to do so in the context of a pandemic means that all of us have to continue to be all in our effort to fight COVID-19. This plan is a plan for the health system, but really it's a plan for all of us. I'm very proud of the work done by the officials of the Ministry of Health. You'll know that the changes in the plan that we put in March that the Premier announced at that time was made in a very rapid way based on what we knew in other jurisdictions. We had not had the experience in British Columbia. The work here has involved months of planning by health authorities and led by Dr. Henry and our Deputy Minister Stephen Brown. It reflects, I think, the extraordinary commitment of the Premier to a public healthcare system that meets the needs of British Columbians at a time when their needs are highest, during a time of two public health emergencies, both the overdose crisis and the COVID-19 public health emergency. I'm very proud of this plan, and we're happy, of course, to take your questions.
A reminder to reporters on the line, please press *1 to get in the queue. You'll be allowed one question and one follow-up today. Our first question is from Ian Bailey. Go ahead, Ian.
Hi there. Perhaps a question to Dr. Henry. How many tests are now being done for COVID-19, and how do you get to 20,000 tests per day? What kind of challenge is that, and how are you going to get up to that level?
Sure. So our capacity right now is around 8,000 to 10,000 tests per day around the province. And I say there's a bit of a day by day, it changes a little bit because there are some of the machines that we use where there has been challenges getting some of the reagents, the stuff that we need to do the test. So we want to double that capacity. We're doing about 5,000 to 6,000 tests a day. So not everybody in the province needs a test, as we know. It's people who are symptomatic when we're investigating an outbreak or a cluster. So our capacity has gone up and will continue to go up. And we do expect the demand and the need for testing will go up as well, particularly as we head into influenza season. It is the same machines that do both influenza testing, other respiratory viruses, as well as COVID.
Do you have a follow-up, Ian?
Yeah, sort of a similar follow-up. How are you going to get more people to take the flu vaccine? What were the numbers last year pre-pandemic, and how do you increase those numbers this year in the midst of the pandemic? What are your goals?
Yeah, so, we want everybody who is able to have an influenza vaccine to take it this year to protect themselves and their family. And we know that this vaccine is safe. We know that it's effective. It's not 100%, but depending on what is circulating, we know there's several strains of influenza that circulate every year. So last year we had a relatively mild influenza season, although we did have H3N2, which is one of the ones that causes more severe illness in older people. We know that. So that was part of our season. And then later in our season, we had more influenza H1N1, which tends to affect younger people, and also influenza B. When we looked at what happened in the southern hemisphere this past few months, they had a very mild season. Partly we think that's because their immunization rates were very high. And partly it's because of the circulating strains that they were seeing. We can't always use that to understand what's going to happen here, but it gives us a good idea. They also, we know that people in British Columbia are very aware about respiratory infections right now. We know that the symptoms of influenza and COVID, especially early on, can be very similar. So we all want to stay healthy during this coming season, more so than ever, so that we're not having to go get tested, trying to figure out what it is. And we know as well that influenza causes severe illness in quite a lot of people, particularly our elders and seniors. So this is a year where we will be encouraging and making available the vaccine to everybody. Our rates last year in healthcare were very high. We were in the 70% to 80%. Our residents of long-term care homes were quite high, as they are every year. But this year in particular, we want everybody in the population to consider getting the influenza vaccine as well.
Our next question is from Richard Zisman.
For Premier Horgan, part of the conversations around the fall and people potentially getting sick has been the federal sick day program. And do you have any insight of whether this is going to happen and or when it will happen, and is the province thinking about any bridge to help support, teachers or any other workers or parents who have to take time off if they start feeling ill?
Well, thank you for the question. And certainly the National Sick Pay Program is something that we're particularly proud of here in British Columbia. We spearheaded that call. Dr. Henry made it clear to me and Minister Dix early on in the pandemic that back in March and April, that when we came to the fall, we were going to need to be prepared for a whole host of eventualities that we had not yet contemplated. So British Columbia brought this issue to the national debate at the Council of Federation, and the federal government agreed with us, and Manitoba and Yukon Territory particularly, and they are going to launch a national program this fall. I'm heartened that the then Minister of Intergovernmental Relations is now the Federal Finance Minister, Minister Chrystia Freeland. She was part and parcel of the discussions on a weekly basis, and I'm confident that she understands fully the importance of getting this program launched this fall. Having said that, it's a national program at this point. I have been in discussion with Minister Dix and Minister James about what role British Columbia could play if there is a delay, if there is an obstruction to what we believe is an appropriate national program. At this point, I've not heard any warning signs that that's going to be the case. So I'm awaiting a positive announcement by the Prime Minister and his team shortly.
Richard, do you have a follow-up?
I do. And for Dr. Henry, to the announcement you made yesterday around restricting the hours of alcohol at restaurants and closing nightclubs and banquets, we've heard some concern from owners who made substantial changes when it comes to nightclubs around putting in plexiglass and trying to comply. They are now concerned about, their future well-being. Also, restaurants who count on that last hour of the day to make profits selling alcohol, that's now gone. What do you say to them? And also, just on a side, I know you mentioned Halloween in the technical briefing. We can't actually use those quotes, so I'm hoping you can speak again about Halloween.
Sure. Well, why don't I start with Halloween? And surprising to me, I've gotten dozens of questions, and when I was talking to young people in the school a couple of weeks ago, that was one of the questions they had for me as well. And yes, absolutely, I think we can have Halloween this year. It's just going to look different. Like everything is looking different during this pandemic. So we're working on some guidance that we'll put out around this. But I really think we need to think about small groups outside, not having somebody come into your house, but having maybe the neighborhood doing things at the end of the driveway, having prepackaged treats for kids so that they're not rummaging around in things. And there's lots of ways we can still celebrate, and I think it's important for us to still celebrate during this time. In terms of the nightclubs, I mentioned this yesterday as well, we've worked with the industry quite extensively over the last few months since we had our first transmission events and outbreaks and challenges finding people after exposures in some of the nightclubs. And I will recognize that they had done a great job trying to make these things safe. But by the nature of the environment, the type of entertainment, the things that people go to a nightclub to do, it is an inherently risky thing in this time of a pandemic. And it's not unique to us here in BC. We've seen it in Quebec, in Ontario now. We've seen it in places like Korea, where they had things very much under control, and there was extensive outbreaks related to transmissions in nightclubs. So I know it's challenging for the industry, but they are just not safe environments right now, and it has taken up a huge amount of public health resources to try and track people, and we know that that's why some of this transmission has happened around the province and in other places. The same goes with the standalone banquet halls. We're not talking about some of the smaller venues where people have private clubs where there's small events and things. What we're talking about is a number of banquet halls where the primary focus is having large events in multiple rooms, and it has been challenging for that industry. We've heard from them. We've gone back and forth. They've asked for lifting of restrictions of numbers, but we've also heard that it's very challenging for them, once people go into those environments, for them to maintain those safety protocols that we've had in place. And we have seen transmission events happen repeatedly at those venues. So, that is part of my role, is to ensure that when we have risky venues, that we take the actions that are needed to decrease those risks and protect people in our communities. And I was reflecting on this. It really is, in some ways, like the cruise ships were in March and April, when we were recognizing that even with the best safety protocols in place, there was by the nature of the activities that took place and the nature of the facilities that we're talking about, they are inherently risky in this time of a global pandemic. And did you want to? Okay.
Our next question is from Binder Sajan.
Hi there. I noticed that there's a regional approach here to hospitalizations, and I'm just wondering if that means we could in the future see a regional approach to restrictions.
Well, I'll ask Dr. Henry to speak to the latter, but I think what we're talking about are very different things. What we're saying in terms of our approach to hospitalization is that should there be in a region issues around hospital capacity, if you reach, for example, within a regional context scenario 3 in a region, whereas other regions are at scenario 1, that you would adjust differently in different hospitals. In March, you'll recall, I made the decision, supported by our whole team, to cancel scheduled surgeries in BC, and we did that across the province. And what we're proposing in terms of the management of the capacity of the healthcare system is the potential for a more regional approach based on the evidence we saw in March. The issue of restrictions is a very different issue. And I just make this point that if you look at what's happened in the last number of weeks, for example, we've seen an increase, a relative increase in the number of cases in the Northern Health Authority, such that the Northern Health Authority, which has a smaller population, has more cases than 2 other health authorities. In July, in the Interior Health Authority, we saw an increase in cases in that time, you'll recall, principally around Kelowna. So the reason why public health measures, the measures to suppress transmission, should be province-wide, is that there is no place, no community in BC, and you've seen it in the data, that isn't vulnerable to COVID-19. But our approach in terms of managing our healthcare system should be based on the reality in front of us. We learned from what happened in March, and the plan, the comprehensive plan, which is backed up by some of the most significant increases in resources any public healthcare system has seen in 1 year in the history of Canada, is a plan designed to respond to that, ensure our healthcare workers are safe, and to ensure patients are safe and have the care that they need. So this is a more flexible plan that we put together for hospitals in particular and community care than in the spring. But with respect to healthcare prevention measures, those continue to be province-wide.
Do you have a follow-up, Binder?
I do, and I just wanted to see if I could get reaction to Transport Canada rescinding the ability for people to stay in their cars on BC ferries on lower passenger desks.
Yeah, we were disappointed with the announcement from Transport Canada. I've raised this with the Deputy Prime Minister as recently as a few hours ago. We believe that our marine highway is an integral part and essential service to the huge number of British Columbians, and we believe that we can safely transport people, provided that we have support and cooperation from Ottawa. This is not something we sought. This is something that's being imposed, returning to a previous situation that we also felt was a bit heavy-handed for the inland waters that our ferries travel in. Vast majority of that is. So we're certainly going to continue to press the federal government. We have, I think, the directive takes effect September 30th. We are in the throes of moving resources into public transit, whether it be BC Transit, TransLink, and BC Ferries, so we can stabilize our public transportation systems. This is an unwelcome intrusion by the federal government at this time, and we're going to pursue it aggressively.
Our next question is from Tina Lovegreen.
Thank you. In terms of encouraging more people to get the flu shot this fall, will the province be covering the cost of those vaccines for people who normally would have to pay for it? And what about the access to the flu zone vaccine for seniors in BC who don't live in long-term care home? Will the cost for that be covered as well?
So on the latter point, we're receiving 47,000 doses, and those are going to be focused of the flu zone vaccine that will be focused in long-term care and assisted living. The plan is to continue to make the influenza vaccine available under the same basis before. A number of people, of course, receive those immunizations without cost, and that will continue to happen. And we're hoping to, of course, expand out both the percentage of seniors, for example, who use it, and the percentage of everyone over 6 months who's eligible to use the influenza vaccine to see that it happens. So it's going to be a similar plan than before, except there'll be some different ways of distributing because in response to COVID-19, and obviously the high-dose flu zone vaccine will be available in long-term care and assisted living. Perhaps, is there anything to just in terms of how we get that?
There are very few people who are not eligible for free flu vaccine, and this year more than ever, we have the availability of vaccine to provide it to them. We know that some workplaces provide it. We know that adults who visit long-term care homes, who have elderly people in their home, have people at risk in their home, who visit any of our healthcare facilities are eligible for the vaccine.
Do you have a follow-up, Tina?
Yes, thank you. Dr. Henry, you mentioned the shortage of testing reagents. How concerned are you that these shortages will mean that we can't meet the target of 20,000 tests per day? And if we could also get the answer in French, please.
Yeah, this is something we're working on, and our provincial public health laboratory, Dr. Cradgen and his team, have been working with our colleagues across the country. So there is an initiative to develop the reagents that we need and the equipment that we need in Canada. Part of it, of course, is the fact that these machines come from other countries, primarily the U.S. and China, and the availability has been a challenge. But we do have a plan, and we're making good progress on that. As a matter of fact, I was on a call yesterday where we were looking at where we've come around being able to access it. So I'm confident that within the few weeks that we'll be able to get where we need to be.
Oui, juste pour dire en français que nous avons en place pour maîtriser cette situation. Bien entendu, on a augmenté le nombre de tests depuis quelques semaines. On a fait, je pense, 5800 dans une journée cette semaine. Donc, cela met des pressions sur le système. Mais en général, je pense qu'on va être en mesure de répondre et de pouvoir faire 20 000 tests au commencement de novembre quand cela peut être nécessaire. Maintenant, tout le monde est libre, qui a des symptômes, est libre de recevoir des tests. Et c'était à cause de cette exigence de la part du public qu'on a augmenté le nombre de tests depuis quelques semaines. Mais on est prêt. Bien entendu, le fait que dans plusieurs d'autres provinces, il y a beaucoup de tests qui sont en train d'être faits quotidiennement, souvent sur des gens qui sont sans symptômes, a une influence, mais je pense qu'on va être en mesure de répondre à cela et que notre plan va être prêt pour le mi-octobre, 1er novembre.
Our next question is from Shrishti Gangdev.
Hi, thank you for taking my question. I'm just wondering if there are more concerns this year with potential illness or sickness in people who have unstable housing, who are maybe sleeping on the streets, and whether there will be kind of concerted efforts to get the flu vaccine to them.
Yes, there's been, first of all, an extraordinary effort, and want to acknowledge the work done by medical health officers across the province, by health authorities. It's particularly true in Vancouver Coastal, to ensure that to the maximum extent possible that all people are protected against COVID-19. So you'll see in our plan, it's a very important part of our plan to protect vulnerable communities of all kinds. So that means seniors, of course, and you can see the very significant investment to protect seniors and to support seniors. That includes supports in the community that we've seen and supports in long-term care and everywhere else. See vulnerable communities such as those with chronic diseases who will be receiving, as part of our plan, getting additional supports and supports for primary care, and people who have who are lacking appropriate housing of whatever kind, also receiving support. So all of these are significant parts of the plan that's put in place, and I think there are obviously profound challenges with the COVID-19 pandemic, of this public health emergency. We know its impact on the other public health emergency, the overdose crisis, and we continue to bring measures forward to address that as well, and we will continue to in the days to come to address that question. But in terms of vulnerable communities, I think the work done by public health care in combination with housing and everyone else in the province has been one of the things and one of the groups of people and one of the efforts that have involved all those communities themselves and public health that I'm most proud of as Minister of Health. I think when we look back at this one day, as I hope we will, their work, the work of people such as Dr. Daly and Dr. Lasician in Vancouver Coastal Health, for example, led by Dr. Henry, I think that work is some of the work that's been the most extraordinary during this period of pandemic.
Do you have a follow-up, Shrishti?
Yeah, also with the colder weather approaching, I'm wondering if there are also concerns about maybe crowding in extreme weather shelters, and if there are concerns, what's being done to mitigate those risks.
Yeah, obviously that's something we're concerned about every year, and we've seen the downside impacts of some of the measures that we've put in place to protect people from COVID has meant that some of our shelters, the capacity in shelters has been reduced. That is something we are looking at addressing, whether we have more temporary shelter spaces available for people. We also know that the economic impacts of this pandemic have mean that there's more people who are in marginal housing or couch surfing who are going to end up needing support. So health authorities, our teams are working on that for sure, and that those plans are part of how we're going to manage in our communities coming the fall and into the winter.
Next question is from Lisa Yuzda.
Hi, they're just asking for one little thing here first. With immunization, some clarity on if you're not in one of the highest need groups like young kids, elderly, families of them, can you just walk into a pharmacy? Will you be able to walk into a health unit, say you're a healthy 25-year-old, and get your vaccine paid for?
In my ideal world, yes. And I think this year more so than ever, there are very few people who are not around somebody who's at high risk. And so there are very few people who would not be eligible for our publicly funded influenza program here in BC.
Do you have a follow-up, Lisa?
Yes, Premier, regarding transportation, looking at WestJet and Air Canada, I'm wondering your level of frustration and what moves are being made for Air Canada not following in the footsteps of WestJet and taking people's names, numbers, being more proactive.
Well, a high degree of frustration. And again, that when Minister Dix, Dr. Henry, and I get together to discuss the range of issues before us in terms of advice from public health, in terms of how we implement healthcare policy across the province, my responsibility is to take all of that advice and find solutions. And we have been working very cooperatively with the federal government. As you know, I seem to say this at every one of my weekly availabilities, that we have a strong partner in Ottawa, but there are some issues that just seem almost incomprehensible. We had some challenges early on when it came to correctional facilities, federal correctional facilities. It took a lot of time to get what we agreed, the three of us and the team of health care professionals, a lot of time to get to what were pretty simple solutions. Similarly, when it comes to letting the province know who's on a plane and where they're sitting and who's beside them, WestJet can figure it out. Other carriers can figure it out. Why Air Canada seems to have a challenge with this is a mystery to me. Again, this is largely a federal responsibility, and I know that I've spoken directly to the PM about this, and he is seized with the challenge. And rather than focusing on encouraging people to get out of their cars on the car deck for the trip from Swartz Bay to Pender Island, I would prefer that the Transportation Canada officials were getting us the information we need so we can protect British Columbians and keep them safe.
Our next question is from Vaughn Palmer.
Good afternoon, Premier. I know you'd be disappointed if you didn't get a question about an early election. In the CASA agreement with the Greens, you agreed not to request a dissolution of the legislature for an early election, except following defeat on a motion of confidence. Do you still consider yourself bound by that agreement?
Well, I certainly, we've had great success here in British Columbia over the past 3 years with a collaborative approach to governing, working with the Green Caucus. You know full well that the Green Caucus today is not the Green Caucus of 3 years ago. You will also know that the vast majority of the elements of CASA have been realized. And you will also know that nowhere in that document will you see the word pandemic. So the world we live in today is not the world of 2017, and I know that British Columbians want me to focus on 2020 and beyond rather than looking backward to a relationship I had with the then leader of the Green Party and his colleagues, and that's my focus, quite frankly, making sure that we're addressing the issues that are in front of British Columbians today. That's why I'm very proud, along with Minister Dix, with the extraordinary work that's been done by public health officials, the Ministry of Health, and health authorities across British Columbia to keep British Columbians safe. An additional $1.6 billion to that task being announced today. Next week, Minister James and I will be looking at the extraordinary challenges we have for our economic recovery and the plans we have in place for that. That's my focus, Vaughn. I know that it would help with speculation if I said something different, but I think the speculation is going just fine, apparently without me.
Do you have a follow-up, Vaughn?
Yes, I do, Premier. You did sign CASA. Are you suggesting that you don't feel bound by the terms of what you signed any longer?
Again, you can parse my words. You get paid to do that by 750 words at a time, Vaughn. What I'm saying is what is as evident as the nose on my face. We are in a global pandemic that did not get contemplated in CASA, and that's my focus right now, not an agreement that has served British Columbians and the legislature well over the past 3 years. I'm focused on the task at hand, and that's a global pandemic.
Our next question is from Dirk Meissner.
Hi, Premier. What was laid out today with the pandemic plan? Would you say that sorry, I've lost my train of thought. Hang on a sec here. Oh yeah, would you say that this plan is our plan to fight the second wave of COVID-19, of possible COVID-19 coming?
Well, as Minister Dix and Dr. Henry have said, we know more today than we did in March when the three of us stood at a hotel in Vancouver in a crowded room filled with media, filled with others, to make the announcement that we were, in fact, in a global pandemic and that we were taking extraordinary emergency measures to address that. We're 7 months later. We know a great deal more than we did then, and we are building every week on the steps that we've been able to take here in British Columbia to keep British Columbians safe. I'm very confident that the plan announced today will create more safety in our long-term care sector. It will ensure that our acute care sector is prepared should there be a crush or a surge of patients in the fall. And of course, going back over the past number of weeks, Minister Dix is updating us on the status of our elective surgery regime. Extraordinary work by healthcare professionals, doctors, nurses, those that admit patients, those who release patients, and everyone in between has done extraordinary work. We're adding to that today. And as at the end, we'll see. We will continue to focus on putting in place the resources British Columbians need to have confidence that their government's working every day to make sure that they're safe and that we are getting back to a place where our economy benefits all British Columbians.
Do you have a follow-up, Dirk?
Yeah, thanks, Premier, for bearing with me there. I was having thoughts of an election running through my brain there. I also wanted to ask you if you are going to be getting a flu shot this year.
Absolutely. I have been getting a flu shot every year since I became of a certain age. And I think actually Dr. Henry and I did it together last year. I don't know if your dance card's filled, Dr. Henry, maybe we'll do it again. But absolutely, I fully intend on not only getting an influenza vaccination, but encouraging as many people as possible to join me.
Our next question is from Shannon Waters.
Hi there. I'm curious about PPE at this point, specifically the province's efforts to acquire more. I'm curious about what stage the pandemic allocation framework is at. We had been at stage 4 for a very long time, basically since the spring last I checked. And I'm wondering if we've started building up a stockpile, and if not, what the province plans to do differently to ensure that we have enough PPE for healthcare workers going into the fall.
Well, Shannon, the answer to the question is yes, and we report on it every single week in detail. What you see in this plan is for example, the 6.3 million N95 or equivalent respirators that we purchased since March under very challenging world conditions. I think the efforts by the Provincial Health Services Authority and by the Ministry of Health have been exceptional in that regard. I think 95% of those have come from provincial sources. We've already also received some support, 5% of those from the federal government in that case. And so if you look through every week, we report on our efforts every single week to not just procure more PPE, but to have testing capacity here in British Columbia, which we've also advanced. So we're very confident in our ability to continue to get the PPE necessary. The provisions we put in place in March to deal with what was at that time a dramatic increase in utilization at a time when the world market for PPE had been fundamentally disrupted. We continue to have those things in place, as you suggest, but we're also, of course, continuing to purchase, and every week we report on it, and every week we're going to continue to report on it. We had about 6 million, for example, N95 masks that we'd purchased up to July 27th when I reported on that in detail on utilization and on the need for more masks. We need about 6 million more through the end of the fiscal year, and we're well on our way to getting them. In addition to that, I would say that the federal government, and you saw the agreement between the federal government and the province of Ontario and 3M recently with respect to N95 respirators. The federal government, our government, and governments across the country are working together to develop more domestic supply sources for PPE. At the moment, we're having obviously more success with things such as gloves and gowns than we are with N95 respirators, but we expect that to change over time. So there's an effort towards the long term, but British Columbia, I think, has led the way in terms of getting the PPE we need and ensuring that it's properly used in our healthcare system, and we're going to continue to do that. Our commitment to our healthcare workers is we're going to do that. We have, and we will.
Do you have a follow-up, Shannon?
I guess I'll re-up my original question. Maybe Dr. Henry is able to answer it. Where is BC's PPE pandemic allocation framework at this point? which stage specifically. And then as a follow-up, I've been trying to get information about the impact of the surgical shutdown in the spring, specifically around how many people who were waiting for surgeries have passed away while waiting for them, or had their conditions worsened to the point where a different procedure, maybe a more prolonged or invasive one, is needed as a result of that shutdown. And I'm wondering if that information is available at this point.
Yeah, on the first question, we're still at stage 4, as I said in answer to your first question. With respect to surgical procedures, I think we've reported out on our second monthly success in terms of getting surgeries done. That was as of, I think, around July 27th. About 2/3 of people who had had their surgeries deferred had had those surgeries. We've also provided significant information about mortality rates in the province and other information. So in terms of our surgical plan, the details will continue to flow in monthly reports, and we'd be happy to get anything else you need in the future.
We only have time for one more question today, and it's from Les Lane.
Oh, thanks. Dr. Henry and Minister Dix, you both continually warned that with the reopening and the restart in May, June, that there would be an uptick in cases. Did you expect that it would get to the point where it would go right back up to the March levels and even much higher? And how much of the fall-winter plan that you just announced is kind of driven by the sustained increase in the number of cases through July and August?
I think the plans, and I'll ask Dr. Henry to talk about the details of the numbers, but of course the evidence always changes the plan. We're always making adjustments, as you saw Dr. Henry do yesterday with respect to provincial health orders. The situation now is different than it was in the spring. In the spring we saw relatively higher levels of hospitalization, nothing like what we had prepared for. But as you know, about 149 was our maximum, and about 72 was our maximum in critical care, and we're not obviously anywhere near that now. So we have more information now, and you see in the detailed scenarios that are put out in our plan, the detailed ones that are presented in the longer version of the plan that you received in the technical briefing, Les. You see us prepare for all scenarios now, including a very significant increase in hospitalization. That's not what we expect, but that's what we have to prepare for, and that's what people expect us to prepare for. So the evidence always changes, and we're always adjusting in public health to the evidence and to the circumstances in front of us. What we have seen in recent times is different people, I think it's fair to say, who have been testing positive for COVID-19, including younger people, people from 20 to 40. We've discussed this regularly in briefings. And I think this plan reflects both what we learned in the spring, what we've learned over the summer, and what we're learning right now. And we'll continue to make adjustments. But the important thing about this plan is that the resources are in place for our healthcare professionals and our healthcare workers, that we're building and improving our public healthcare system, I think, and this is an extraordinary thing, in the time of pandemic, and that our public healthcare system is showing why it's so important as a value and as a practical fact in Canada. Having public healthcare makes all the difference. We have the means to do what we need to do to respond to this pandemic within public healthcare. And having this public healthcare system in place and then supporting it and giving it more resources to address the time of pandemic is exactly what needs to be done, and that's what this plan does today. I'll leave it to Dr. Henry.
You know, I guess I've been asked many, many times, you know, what about a second wave? Is there going to be a second wave? Are we going to have a second wave? And one of the things that we have learned about this virus is that it's new. It's not influenza. It's not what has caused SARS in 2003. So we are watching and learning as we go, as Minister Dix indicated. So did I expect it to go on this long? Did I think potentially we could have suppressed it over the summer? I think I've talked about this before, that we knew that with some coronaviruses we get a reprieve in the warmer weather. That didn't happen with this. That was a possibility as well. So it's really hard to say, you know, I didn't have any set ideas about what we were going to see. We started seeing in other countries around the world that were phased ahead of us in how their pandemic wave came through, that they were starting to see transmission amongst younger people. So it was not a surprise when we started to see that as well. and we had set ourselves up to make sure that we could watch very carefully for hospitalizations, ICU, outbreaks in long-term care. But we also, and we've talked about this many times, talked about the unlinked cases. And way back in March, I think it was March 8th when we had, or March 5th when we had our first community case with somebody who had got it here in BC. That's something that we've been watching very carefully, and that is one of those indicators that helps me know if we are doing the work of public health and keeping this virus at a level that we can manage it in our community and get everything else started as well. So we are in a good place that way. Could I have predicted it would be like this, that we'd see these numbers now? No. I think part of what we were facing on March 12th when we were looking at the curve going up is not knowing how high it was going to go and how long it was going to last. So we did a very good job here in BC, thanks to the measures that everybody took at keeping that first wave quite low. So these numbers are concerning to us, but they don't reflect widespread transmission in our communities that we've seen in other places that have overwhelmed health systems, and we need to keep it in that focus. And that's what our planning is working on. That's why we're spending so much time and effort in contact tracing and in adding additional resources to contact tracing. And as I've said many times, I do know that influenza season will come, so we need to take the best measures that we can to protect ourselves and our families and our communities from influenza as well, so that we can continue to keep this balance in the coming months.
Les, do you have a follow-up?
Well, just on the testing, you're going to ramp up to 20,000 tests a day. That's like 3 or 4 times the current rate. I think the dashboard says they did 3,500 yesterday. Does that invalidate comparisons? First of all, does that invite, obviously, more positive tests? And does that invalidate the kind of comparisons, the day-by-day horse race in terms of how many new cases there are?
Yeah, no, I would like to be able to change our day-to-day into looking at rates and things over time, which we will eventually. But what we're talking about is capacity. So it's not the number of tests that we want to be doing every day. We can't predict that. The number of tests we do every day depends on the amount of disease we have in our community, the number of people who need to be tested. And as you know from here in BC, we've always had a focused testing system. So early on, we did quite wide testing of anybody who traveled, because we knew it was going to be introduced. Then we focused on those people where we knew it would make a difference in our healthcare system and protecting the healthcare system, and that's because we had limited capacity. We're now at the point where we test anybody with symptoms and some people without symptoms if they're in a high-risk situation and public health is doing an investigation. So we need to move into the fall to make sure that we can have the capacity to test people who have any respiratory symptoms so that we can continue to keep a handle on COVID, but also make sure that influenza, which also causes outbreaks and disease and significant impacts, we're able to test those people as well. So it's not that we're going to try and do 20,000 tests per day just for the sake of doing them. It's that we have that capacity to meet the needs that we might have as we go into the fall.
Thank you, everyone. That's all the time we have.